What's up, everybody? This is the Ray Nurse Nay here. Today's video I'm going to be talking about what specialties you can work in as a bedside nurse in the hospital edition with adults. First up, we're going to start with the ED. So when your patients, most people know what the ED is. That's the emergency department. If you have an emergency, life or death situation, you're going to the ED, right? Nurses work there, doctors work there, providers work there, staff work there. That's its own little world, okay? Next up, you have the ICU, which is short for intensive care unit. Those are going to be your patients that are typically on their deathbed, super dying, super unstable. Those patients are going to be on the ICU, okay? Think ventilators, extreme electrolyte imbalances that puts them at risk, at cardiac risk, at all kinds of risks. Those are your ICU patients. Next, you have the step-down unit. Not all hospitals have this. Some hospitals do. It's basically a unit where if you're not sick enough to be in the ICU, but you're too sick enough to be on a regular floor, you're on the step-down unit. Those nurses have a decreased ratio, normally 4 to 5 patients. Next unit from there, you can have the medical surgical unit, the med surg units for short. That's what I work. Those units are going to have a mix of anything and everything. Those nurses in the hospitals are typically going to have the highest nurse-to-patient ratio. They also have the most issues with staffing. They can't keep people there because in those roles and those, you're going to be dealing with the most burnout, the most stress. You're going to be dealing with high patient acuity, high patient ratios. You're going to be taking care of acute issues, chronic issues, ADLs. You're literally going to be your patient, nurse, doctor sometimes, CNA, tech, chaplain, past all the things. Okay, very, very busy unit. Now that's in the adult unit. They have specialty med surg units at bigger hospitals, but not always the case with smaller hospitals. Sometimes it's mixed. It's definitely on my unit. It's a smaller hospital. As a med surg nurse, I have taken care of patients on chemotherapy, on heparin drips, on cardiac drips, on PCA pumps with GI issues, recovering from all types of ortho surgery, even cardiac surgeries on my med surg floor. So it's very specialized, not specialized, very generalized. And in these same units, you can have different ones depending on what hospital you work at, and also in other departments. So like, say for instance, these same units, you can see this if at a pediatric hospital specifically for kids, or at a women's hospital that's specifically for women. Think of labor and delivery, NICU for sick babies, for sick moms, that sort of thing. You can work at any of these as specialties as a nurse. So pick what interests you and go for that.